Good afternoon. This presentation will be added to the course for the group who are interested in fetal cardiac scanning, and this session is going to be about the basic fetal cardiac screening. This is a diagram showing the fetal circulation. The main blood supply for the fetus and the oxygenator is the placenta. The oxygenated blood goes through the umbilical vein, through the ductus venosus to the right side of the heart. Most of the blood crosses the foramen ovale to the left side, to the left ventricle, and then to the ascending aorta. Part of it goes to the right ventricle and then to the pulmonary artery, and then through the ductus arteriosus to the rest of the body. The deoxygenated blood from the fetus comes through the umbilical artery and then back to the placenta for oxygenation. This is a diagram that I took from this article in the Journal of American Society of Echo, showing how to decide about the situs of the baby, of the fetus. And basically what you do is you put the baby in a longitudinal plane with the head of the baby to this side of the screen in front of you, and then from there you rotate 90 degrees, and then you will be able to see the baby in an axial plane, and you will see one of these pictures. This represents the spine, and the sternum is here, and then if you put the baby in this side, if you see the spine towards this side, then the right is down, the left is up, and the opposite for the other side. And remember it as rotation in clockwise with the spine outside, and the right comes before the left. Okay? Let's see an example. Here the fetus in longitudinal position with the head towards the left of the screen in front of you, and it doesn't matter where the sign here is, and it doesn't matter also where the marker of the probe is. This is the beauty of this article. And then here we see we are rotating 90 degrees, and then we look at the images. Let's see it again. Let's freeze it here. So this is the spine. This is the spine. This is the sternum. This is the stomach bubble. Okay? So if this is the spine, this image looks like this one. So this is left, this is right. Okay? So the stomach bubble is towards the left, and then if we continue, we will see the hepatic veins joining the UVC, or joining the IVC, and then joining the right atrium, and then the apex is also towards this side, which is the left. So this is situs solitus levocardia, because the liver is towards the right and the stomach is towards the left and the apex is towards the left. So this is situs solitus levocardia. Another important thing to decide about the baby's heart is the axis. Basically, you draw two perpendicular lines, one crossing from the vertebra to this sternum and the other one in the middle of the chest in this direction, and then basically what you need to look for is the apex. Where is the apex location? It should be around the middle of this part, of this quadrant. If it is too far to the side or too far anterior, this is abnormal. Okay? So this is more left axis deviation, and this will be levocardia. Basic views, we have multiple basic views: upper abdomen, 4 chambers view, 3 vessels, short axis, LVOT and RVOT view, and the arch view. And what the views look like is this is the upper abdomen view. It's basically an axial view across the upper abdomen, where you see the liver, stomach bubble, descending aorta, and IVC, spine and sternum. The 4 chambers view is immediately above that in the same axial plane. You just move from the upper abdomen upward, and then you will see the 4 chambers view, where you can see the 4 chambers: left atrium, right ventricle, left ventricle. And then the 3 vessels view is immediately above that. Usually you see the pulmonary artery a little bit elongated, and then the aorta, and then the superior vena cava. Immediately above the three vessels view, you will move, and then you will see that the aortic, you will be able to see the aortic arch where you connect the descending aorta to the ascending aorta, and then the ductal arch which connects the pulmonary artery to the descending aorta. This is the LVOT view, left atrium, left ventricle, aorta, and this is the RVOT view. And then the most important thing is that these ventricular outflow tracts, they cross each other. So usually we see the left ventricle, and then the aorta is opposite to the direction of the left ventricle, going away from that, and then the pulmonary artery is going away from the right ventricle, and they cross each other. When you move, when you sweep, you will see that they are crossing each other. This is the short axis view, where you see the right atrium, right ventricle, pulmonary artery. This view is very important to see this part of the septum, which is the outlet septum, especially in patients with like tetralogy of Fellow, where you want to see if there is a defect and if there is a stenosis below the pulmonary artery. This view is nice to see. This is the ascending aorta, and this is the pulmonary artery, and this is for the right ventricle outflow tract. This is the arch view. This is the aortic arch, which looks like a candy cane, and it has the head and neck vessels. Here we see the head and neck vessels. The ductal arch is different from that. It is smooth, it has no head and neck vessels, and it's coming from anterior part of the chest, crossing all the way to the back to the descending aorta, while the aortic arch comes from the middle of the chest. This is the anterior part of the chest. This one comes from the middle and takes a shortcut. So this one looks like candy cane, while this one looks like a hockey stick. It's a long one. That's how the two look. How to obtain the views? We will go through them quickly. So the upper abdomen is basically just a straight axial cut through the upper abdomen, through the liver, and then through the descending aorta and IVC. And then just move above that straight in the axial plane, and then you will see the four chambers view. Move one step more, and then you will see the three vessels view, because you will cut the heart just above the four chambers level, and then you will see the three vessels view. The short axis view, here I'll show you the short axis view and long axis view in a while. Let's see some examples for the four chambers. This is the spine, this is descending aorta, this is the four chambers. And here we see the left atrium, right ventricle, and left ventricle. And in this view, it is important to see the size of the ventricles, differentiate the left from the right. This is the moderator band. Usually the right ventricle dimension in this area is longer than the left ventricle, but the length of the left ventricle is longer than the length of the right ventricle. If you notice here, I concentrated on the 2D images. You will rarely need the color. This is an example where you will need the color if you suspect a septal defect, like here. This is the interventricular septum, this is the tricuspid valve, and this is mitral valve. And then if we play the color, you will see that there is a ventricular septal defect here, which is small and what's not easy to see by 2D. We'll move to the ventricular outflow tract. This is the left ventricle, and this is right ventricular outflow tract, and then how to obtain these. If you go to the straight axial four chambers view, if you are scanning in the anteroposterior plane, you will see this image. Just tilt your probe to the side to scan the heart from the side, and then you will see the heart like that. You will see that your scanning beam is coming from the side. You will see that the four chambers is tilted to the side. And then from there, you just sweep up and rotate anticlockwise to see the left ventricle outflow tract, and clockwise to see the right ventricle outflow tract, just by sweeping up and a little bit of rotation. This is an example. See that the beam is coming from this side, and here we are sweeping up. This is left ventricle outflow tract and right ventricle outflow tract. Clear? Okay, the 3 vessels view, we will see how to obtain that. So as we said, it's a straight axial just above the 4 chambers, and that's how it looks. So this is the pulmonary artery, this is the aorta, this is the SVC. You should see them in anteroposterior plane, with the pulmonary artery being the most anterior and to the left, SVC is the most posterior and to the right, and you should have very little difference between the size of the aorta and pulmonary artery. Usually aorta is a little bit smaller than pulmonary artery, but the difference should not be too much. The short axis view, you obtain it by connecting the liver to the shoulder of the baby, the left shoulder. And then if you cut the heart in this plane, you will be able to see the short axis, pulmonary valve. This is the outlet septum, this is the RVOT, and then if there is any obstruction, you will see it. So this is the liver, that's the shoulder level, and that's the plane of cutting the heart. This is an example for how the short axis looks. This is the aortic valve in the middle, right atrium, tricuspid valve, right ventricle outflow tract, pulmonary valve moving here, and these are the branch pulmonary arteries, right and left. The arches, how to obtain the arch views. Again, there is another simple trick. If you are in the 3 vessels view plane, which is the straight axial plane, just try to connect the pulmonary artery to the descending aorta, make the ultrasound beam going straight in this plane, and then you will get the ductal arch by rotating 90 degrees from this plane. So you cut in the axial plane, connect the pulmonary artery to descending aorta, and then rotate 90 degrees, and then you get the ductal arch. To get the aortic arch, you need to rotate a little bit to the side to connect the ascending aorta to descending aorta, to put them in anteroposterior plane, like in this example. So here we tilted a little bit. You see that the baby is tilted a little bit. Aorta and descending aorta are in the plane. Pulmonary artery moved a little bit to the side, and then from there rotate 90 degrees, and then you will get the aortic arch. This is an example showing both arches. This is the aortic arch with the head and neck vessel, and then this is the ductal arch, which is longer one coming from anterior. The aortic arch is coming from middle of the heart. It takes a shorter cut, and it is showing the head and neck vessels. So here we are just sweeping between the ductal arch and the aortic arch. In the same sagittal plane, you should also look for the SVC, which is this one, this is the SVC, and the IVC, which is this one, to see patency of the superior and inferior vena cava. The arches are very important to look for and to observe their flow. This is another place where the color flow Doppler is very important. It's very important to see similar color in both arches. This is blue and this is blue. If you get the 2 arches in different colors, that means one of them is obstructed. There is one obstruction to one side, either the right outflow tract or the left outflow tract. And the color flow in the arches is very important. So a quick checklist for what we have said. In the upper abdomen, we look at the liver, stomach, aorta, IVC. In the 4 chambers, we look at the cardiac position, axis and size, symmetry of the chambers, AV valves, the moderator band, which is this one, pulmonary veins, and here also we need to use the color flow Doppler. The septal integrity, if there is any ventricular septal defect, it's hard to look for atrial septal defect, and we look at the function and also if there is any effusion. The 3 vessels view, we look at the vessels, the number, the arrangement and size. We look at the aortic and ductal arch, trachea and bronchi, which I'm not the expert to look for, and the branch pulmonary arteries. The left and right ventricle outflow tract, we look at the crossing nature and patency of the outflow tracts and septal integrity. Subpulmonary outflow tract, we look at it in the short axis view. We also look at the outlet septum if there is any hypertrophy and obstruction or septal defect. The 2 arches, we look at the shape, size, narrowing of the ductal or aortic arch. We look at the head and neck vessels, and most important thing, we look at the flow direction. Make sure that they are not opposite in color, that they are having the same color. Thank you very much.